Faced with the challenges of dual psoriatic arthritis diagnosis. Around 1.5 million Americans suffer from psoriatic arthritis, PSA. PSA is only component of the tale for many of those individuals. This is due to two or more chronic circumstances for patients. It may be hard to diagnose psoriatic arthritis, PSA, since symptoms such as rheumatoid arthritis, osteoarthritis, fibromyalgia, and gout are common. In America 2016, most individuals who have PSA experience several symptoms over the period of years before the disease is correctly diagnosed, according to the Psoriatic Arthritis study. In the study, at least 41% of the individuals had been diagnosed with PSA by at least 4 healthcare experts. What is the difference between PSA and rheumatoid arthritis like? Psoriatic arthritis and rheumatoid arthritis, RA, are autoimmune diseases that are caused to swell, suffer, and stiffness in the joints by the immune scheme. Dr. Mark, Director of Rheumatology in Stanford Healthcare, explains that psoriatic and rheumatoid arthritis are comparable, but are distinct illnesses, with manifestations often quite comparable. There is no coexistence generally between the two illnesses. However, doctor points out that the kind of arthritis a patient has may be uncertain during the first months or even years of arthritis development. According to physician Jason, a rheumatologist in USA, dactylitis is one of the characteristics which separates psoriatic arthritis from rheumatoid arthritis. Fingers or toes swell in this situation and become like sausages. Emphasis is also characteristic of psoriatic arthritis that does not happen in rheumatoid arthritis or arthritis in fields where ligaments and tendons enter the bones. According to the National Psoriasis Foundation, up to 30% of people with psoriasis develop psoriatic arthritis. Signs of the disease can assist physicians distinguish between RA and PSA, such as the red, scaly skin. Physician noted that most treatments for both circumstances are similar, but that some medicines for psoriasis do not treat rheumatoid, and rheumatoid therapies do not provide psoriatic therapy. Frequently both kinds of arthritis are supported by anti-inflammatory medications, NSAID, and corticoids and immunosuppressants. Physician noted that rheumatoid treatment does not treat rheumatoid. PSA overlaps with osteoarthritis. Osteoarthritis is the most prevalent type of arthritis and impacts approximately 27 million Americans, a degenerative joint illness in which the cartilage is wearing away by the era and bone presses. Almost everyone is going to develop arthritis at some point, so osteoarthritis and psoriatic arthritis can certainly be experienced at once, physician says. Although pain relief can assist to handle the both conditions' symptoms, osteoarthritis is not an inflammatory articular disease. Treatment differs also as psoriatic arthritis can react to immune system drugs. Living with fibromyalgia and PSA. Last year Miss Roma of California, USA, was diagnosed with fibromyalgia, which is associated by extensive musculoskeletal pain, combined with exhaustion, sleep, memory and mood problems. She has experienced 30 years of psoriatic illness. She has psoriasis and arthritis psoriatic. I believe PSA and fibromyalgia is very prevalent in the first place. Our physicians only miss it, she claims. Brain fog and tiredness were the greatest shift I noticed. I thought my arthritis psoriatic got worse. My muscles were more painful, more rigid, and more affection. It felt like my whole body was painful. I also understand I have pain and inflammation with my psoriatic arthritis. To obtain the correct diagnosis, explains stresses that patients must be conscious of modifications in their own bodies. When she noticed that she had symptoms other than the usual psoriatic arthritis, she began maintaining a journal. I had pain in various areas of my body, and even after I had rest, pain would get worse, she says. Only 2 or 3 hours, I couldn't sleep. I've always been tired, and I haven't been able to move like I used to. I'd get restless legs together with stupidity. She is now taking one medicine for PSA and one fibromyalgia medicine. Stay healthy. Thank you for watching this. Please do not forget to subscribe, share and like our channel. Click the bell icon for latest update.